Hi, everybody. This is John Tsilimparis. The podcast is Mindfulness for the Soul. We haven't recorded in a while, so we are back finally. And I'm with a guest today, Karen Pickett, MFT. She is a psychotherapist and also my co-producer on the next This Is My Brave show. So let me tell you a little bit about that before I introduce Karen. This Is My Brave is a nonprofit charity that is dedicated to ending mental health stigma, and they produce live theater shows throughout the country. They've done over 60 already, where people with mental health conditions tell their story, and they do it via song, via dance, via monologue, via comedy. So Karen and I are producing the next show, which is going to be in Los Angeles, in Santa Monica, actually, Los Angeles, on September 25th, 2022. So we hope to see you all there. Anyway, let me introduce Karen. Karen Pickett, please introduce yourself.
Hi. So as you said, licensed psychotherapist and co-producer of This Is My Brave, a show that is, I think, a very near and dear to the topic of this podcast today.
Right. So we're going to talk about mental health stigma today, the shame around it and all of the layers, and maybe hopefully shed some light on it for some people, perhaps maybe even offer some alternative ways of seeing it, maybe alter perspectives, maybe give some people tips on how they can understand others that are going through this. So let's talk about that. So we've both worked as psychotherapists for a very long time. So we've seen this, and I've personally experienced shame from my own anxiety disorder and my occasional depression episodes. So I know it very well, but there are people that are really affected by it, and a lot more than I am. And so, if we try to define what it is, it's a lot of things, but it's mainly something that has happened through the years. So a lack of science, ignorance, fear have contributed to demonizing people, ostracizing people. It's based on detrimental attitudes that society has developed, either through the media, negative portrayals, stereotyping them in many, many ways. So we want to try to sort of demythologize all of that. And so, Karen, in your travels as a psychotherapist, what have you seen that has been the most prominent feature of shame about mental illness?
Most prominent feature?
Well, what do you see the most with your patients? What do they tell you about is the hardest part about having a mental health condition and the stigma around that?
I think the hardest part, that what I hear a lot, is the fear of sharing with other people, even their loved ones, that something is going on for them, and one of my specialties is body-focused repetitive behaviors, which is hair pulling, skin picking, nail biting. And on the outside, it looks like, oh, that's just so simple, you should just stop. And it's not, they're not simple conditions, as none of mental illnesses are. They're complex conditions. But my point is a lot of times people with body-focused repetitive behaviors hear this, which I think is a big part of shame and stigma around mental illness, is, just try harder, just get over it, just snap out of it. I was like, yeah, if it was that easy, I would. But it's really shaming to hear that. And it makes the person feel like something is wrong with me, that I can't just snap out of it. I can't just get over this. And so it's like a doubling down on the person's own shame around it, to have other people then shame as well.
So like adding insult to injury, like I'm already experiencing a mental health condition, but I'm also experiencing the invalidating indignity of having my family, the people that I care about, and the people that are supposed to support me, either rejecting that or not understanding that. Okay, that's important to know. Some myths and misconceptions that mental illness is a sign of inferiority, that only unstable people are affected by it, that sufferers bring it upon themselves, that somehow they have some control over it. And this is an interesting one too, that they are accused of pretending to have mental illness in order to manipulate the system or to avoid situations that they don't want to be in. And yeah, again, back to your point, that's a really tough one to sit with, that you're being blamed for it, and that you're trying to get away with something.
Mm, yes. Yes, very much
Um,
so.
so another one is that that somehow people with mental health conditions cannot be productive members of society, that they are incompetent, that they cannot work, and that we know is not true. I've seen, for the last 28 years, I've seen doctors with mental health conditions that live full lives. I've seen law enforcement officials. I've seen CEOs. I've seen all kinds of people. So that's a big myth. And then another one is that the mentally ill possess the potential for dangerous behavior.
Mm.
And I guess anybody has potential for dangerous behavior, but the misconception is particularly inaccurate, because in truth, individuals with mental illness are more dangerous to themselves than they are to others. So I think that's a big one that comes up. You were going to say something about that?
I was just going to say, I mean, I think, what's fascinating about that is, at least, and maybe you've seen this as well, in the patients that you've seen over the years, the clients, I find that my clients are some of the most sensitive, caring people I've ever met, and so to think that this is a part of the population that is just dangerous or violent is completely opposite to my experience
It's
in
true.
treating people with.
I would say the same thing too. Across the gamut, all walks of life, all socioeconomic levels, all races, and again, all occupations as well. So another big part about stigma is what they call internalized stigma, where the individual starts to really believe all of these negative beliefs and misconceptions about them. And so they internally start assimilating that and start believing that maybe they are not worthy of care, maybe they are not worthy of help. And so that affects their ability to access help. That affects their ability to have hope, and they get into the, whatever state of mind, or the efforts. And that to me is not a great place. And maybe society's to blame for that, but what are your thoughts on that?
Well, what came up for me when you were talking about that, John, is that, and kind of going back to something that you said earlier, is that, mental illness, many decades and centuries ago, before there was science, we understood it. People with mental illness were often classified as someone who was acting out of the devil, so there's this long history in religion about what it means to be someone with a mental illness. And I think, that stigma goes way back, and I see it carried on today in some religious cultures, and some clients I've had that have been parts of religious organizations. This idea that it's okay to take care of yourself is really foreign to them. I see, and even clients that aren't necessarily part of a religious organization, I don't really know where this whole phenomenon comes from, but this idea that taking care of yourself is selfish, that, I'm hurting, I need help, this is affecting me, I need to do something about it, is somehow marked as selfish. And people are like, well, I don't want to be selfish, and I don't want to be seen as selfish, And I don't know if you've experienced that at all or heard of that, but it's pretty epidemic.
No, I have. And my parents being immigrants, I've said this on other podcasts before, that, to them, words like depression and anxiety were imports. These were not words that they were familiar with. And so to them, it did seem like someone was being a little self-indulgent if they were dwelling in their minds too much on a problem, if they were, overanalyzing something, or not letting things go. Just let it go, John, and, to my parents' credit, they were trying to help. But I think that's kind of what you're talking about. And also getting back to, either your place of worship or your religious community, also in the workplace, we see that too. So that's more indignity. You're getting it from your family, you're getting it from your workplace. Maybe you even get it from your government, but you're also getting it from your place of worship, from your religious community. And that to me seems like such a tragedy when people need so much support these days.
True.
Here's another thing. So getting back to the why bother attitude, the CDC reports that poor mental health treatment results in an increase in other health problems, and a bleaker outlook for the future. Risk factors are the potential for suicide, substance abuse, legal issues, and future adult psychopathology. So in trying to keep their conditions secret, thinking that it helps them feel safer, they're only making it worse. Now, again, are they to blame for that? Is society to blame for that? I don't know, but that's a little bit of where the shame comes from.
Sure.
This
Yeah.
bleak outlook makes it even bleaker for myself.
Right. Right. Boy, that's huge.
So I have shame about shame. And then also you mentioned this the other day, and I remember another patient said this to me too, that, mental illness is not something you can see. It's not, you don't see it on an X-ray, you don't see it on a CAT scan. When people say that they're sad or they're scared, it's not the same as saying I'm bleeding or I broke my leg or I broke my arm. And that, I think, is another thing to point out, because people believe what they see and what they know. And if they've never known that and they don't see that in any kind of test, it's difficult for them to understand it.
Absolutely. I think one of the things that is happening, and, again, through no fault of people from other cultures, right, who come to this country, or generations ago, when people didn't understand as much as we do today about mental illness, there are these intergenerational patterns where parents didn't even know how to deal with their own mental illness, right?
right.
Or didn't even know if it was a mental illness and might be self-medicating with alcohol or drugs or whatever, or just acting out in ways that then the kids feel really ashamed for anything that looks like those same symptoms or conditions. And they also don't know, they haven't been shown how to work through their mental illness in a healthy way. So then they don't know a healthy way to work through their own mental illness. And it just, keeps repeating through the
Right.
generations.
Right.
And I think, I don't know if we're going to talk about this now or later, but I think in terms of things changing, I think things are changing in that regard. And I've seen that in my own practice. So it does give me hope for the future. But I think there's just so much, there's so many millennium of stigma and there's a big
generations
force,
of
generations of stigma and misunderstanding, really, and labeling in an attempt to understand, but that has been harmful or painful to people.
Yeah, it feels interesting to me that somewhere along the line, something about your brain malfunctioning, as let's say your kidneys or your liver, your heart would, is not okay. And I think one of the reasons why, well, a layer of this as well is that I mainly hear that, someone is considered inferior or weak. But what's interesting is when, let's say, a luminary or a celebrity or somebody famous, and in these days, an athlete like Naomi Osaka and Simone Biles and Michael Phelps, when they come forward, and they're seen as larger than life people, but when they come forward, the opinion of them from the public does not change. It doesn't say, oh, wow, now Michael Phelps is really weak. They actually give him a lot more compassion. So that's where I think that the change has to come via the education, which we're going to talk about, and sort of the shift in perception. Because again, if you look back at all of the celebrities that have ever spoken up about their illnesses, mental health illnesses, you're hard pressed to hear negative things about it. Drug addiction's a little bit different, but with mental illness, they usually get a lot of compassion and they don't shift into a weak person.
No,
So
that's a very interesting point.
Yeah.
And I think that's really only been happening in pretty recent years, right?
Yeah, I mean, there are going to be your groups of people that will say, Simone Biles or whatever it was, Naomi Osaka should not have quit. I forgot what tournament she was in because of her mental illness. You have to be strong because you're an athlete. But for the most part, she got a lot of support and she was seen kind of like a hero. So we need to see and hear more of that stuff. And wouldn't it be nice if if non-athletic people, non-famous people, just normal people like you and I could get that same kind of respect and consideration. But that's something for the future. So let's talk about some of the, and again, I call that the halo effect. So again, you could have depression, you could have panic attacks, you could have OCD, but if you're famous, you've got the halo effect and you're good. So, all right, so let's talk about this. How do we end mental health stigma? Obviously, it's not something that we can do by clicking our fingers and all of a sudden it's over, but a lot of it is going to involve continued education, continued support, continued exposure and discussions like these sort of candid, these discussions of candor. To me, and I know you can say a lot about this too, but to me, it has to be a confluence of influence between, and I know it's already happening, but between the medical industry and the mental health industry, where they work together to use each other in assessments, in evaluations, in treatment plans. I think primary care and GPs need to keep that in mind. And I know that some doctors are doing that now, but some aren't. I know we're seeing more mindfulness practice in schools. So you were telling me a little bit about this the other day. What do you know about all of this and what has changed from what you've seen?
Yeah, it's really interesting because I do have hope for the future and I do see things changing. And two of the things that I see, one is I've had a lot of clients in recent years tell me, and they tell me this with surprise. Oh, I went to my primary care physician and, my new PCP, I'm getting my annual, checkup, and they gave me a depression screening, or they asked me, that's the most common thing I hear. And my clients are surprised, and I was surprised by it at first as well. But I think it's becoming more commonplace that primary care physicians are screening for depression and anxiety and maybe other trauma as well. Depression is the one that I hear the most, for sure.
Yeah, and obviously, if primary care does that all the time, and it becomes part of a new normal, and everyone that goes in for a checkup has to fill this sheet out, or at least is open to answering some questions, because I think some people think that it's too personal to ask, do you ever have depression or do you ever have anxiety? If we can make that part of the norm and take away the shame out of it and simply just asking a question for your well-being, I think slowly that will help to change the perspective, because it still seems like it's hush-hush for a lot of doctors. They don't want to intrude and ask, this very sort of intimate question about, do you ever get depressed? So it has to be a multidisciplinary sort of like treatment protocol for that to come together, and then we can start making it more normal.
Right. And I think, doctors in our society are often seen as very important and powerful people. So if doctors are saying, hey, let's talk about, do you ever get depressed? That's a big step in terms of opening up the conversation and reducing the shame and stigma, because, oh, my doctor is feeling comfortable asking me about this. So I guess it's okay to talk about, to this important person in my life that I look up to, an authority figure.
Exactly. Yeah. And we know that people look up to doctors, psychiatrists are going to hate me for saying this, but they look up to doctors more than they look up to psychiatrists. So everyone's got to be in concert. So again, somebody had quoted, we need to ask the hard questions about, people's history, the taboo questions, the questions that sometimes might seem personally awkward. And so these questions give credibility and normalize mental illness and brings it to light, as opposed to leaving it in the shadows. So if more respected doctors in primary care address these very same important mental health issues over time, it will become routine. It'll be routine from intake. So that's one way that we can start to influence people. What about some other ways that you might have seen? Obviously, more people becoming psychotherapists, more groups available. Oddly enough, because of the pandemic, even though we can't meet face-to-face fully just yet, virtual treatment has actually added more opportunities for people to come together in the mental health field. So that's a good thing. But what are some other suggestions that you think would be helpful for the psychoeducation process?
Well, another thing that I've observed in my practice is I've seen, younger parents or parents with younger kids is, they're reporting things to me like, oh, guess what? My kindergarten or first grader is being taught mindfulness
Mm.
in class. They're being taught about feelings and how to name feelings. And again, that's one of the things that gives me hope is I can see the younger generations, and many of my younger clients that I've seen have been willing to be much more open about their whatever it is that they're struggling with. They tell their friends, they put it on social media, not all of them, but a lot of them,
Mhm.
way more open than I would have ever been as an 8-year-old or a 14-year-old, or,
Mhm.
I mean, so I think because a lot of people who are parents of young children today, or maybe in like their 30s
Mhm.
or 40s, they probably, first of all, have been much more likely to have had therapy, one. And two, there is this feeling of, well, we're teaching it in our schools now. We're starting to give our younger people the skills and tools to be able to not only help themselves, but to talk about what's going on. So
Mhm.
again, just like with the primary care physicians, I think it's another avenue where the conversation is being opened up.
Mhm.
Mindfulness is a way to talk about self-soothing, but also it opens up the conversation of why do you need to self-soothe in the first place?
Right. That's why when I said candor and more unashamed conversations. So if we can
Yes.
teach parents at any age, but parents who may not have had experiences for themselves with mental illness to have that unashamed conversation with their kids or with a loved one. I've seen so many teenagers over the years, and they would prefer not to talk about these issues to their parents. And like you've seen, they can talk about it with their friends sometimes, but uh, they would prefer to talk about it, with a therapist, if at all. And that's why, this organization, This Is My Brave, is so great because it's trying to make the conversation not about mental illness, but just the conversation about a conversation about, well-being and support and all that stuff. Even calling it mental illness has a little bit of a stigma to it. But yeah, so again, the continued education is obviously the key for now. But I think that the continued portrayals that we see in the movies, on TV, I still think are pretty detrimental. I don't know how that's going to change. I know it's gotten better over the years, but I still see that. I still see even psychotherapists being portrayed as either, being how would I say, exploitative of their patients
Mm,
and just wanting to capitalize on their
mm,
pain and their suffering, or they're seen as perfect human beings that have it all together. And as you know, you and
which
I
is
are
true.
well, I shouldn't speak for you, but
I'm just kidding.
I'm your garden variety neurotic, just like anybody else.
Yes.
Or we're seen as people that clinicians that have no boundaries, and that we jump into bed with our patients, or we have what we call dual relationships. So I rarely see a portrayal in the movie of a pretty solid therapist that has good boundaries.
Right. Right. I hear you. I agree.
You
It's
know,
rare. It stands out
it does.
if it does occur.
Yeah. So again, we're sort of coming to the end of our podcast here. And so I think sort of one of the points to take away is that, the negative portrayals and the stigma affects, the human being systemically in so many different ways. Again, their ability to reach out for help, their ability to talk about it, their ability to build self-esteem. I mean, it's pretty hard to build self-esteem when people are telling you that something's wrong with you,
Mhm.
when all you do is maybe need some help, or you need some medication, or you need some support, or maybe even some love. The more we talk about it, obviously, the better it's going to get. But I know that the pandemic has hurt this a lot, although I said before that it's helped it in many ways, but it has hurt it a lot because people with depression have kind of experienced like a double depression. They're already depressed. And then with the pandemic, and a lot of people have lost jobs, and a lot of people have lost property and all that stuff. So it's been an unprecedented time. And I don't know about you, but since March of 2020, it's been pretty busy for me. And that's not all in good ways. And I've really seen a lot of this mental illness sort of skyrocket. Have you seen the same thing yourself?
Absolutely. You know, I think I can't think of very many therapists that I know who don't have a complete, you know, aren't completely full. You know, people are just coming out, which in some ways is very good that people are seeking help. And maybe there is something about being more private or not being at work, or I don't know about the accessibility over you know, Zoom and things like that to reach out and get not only medical care, which is great, you know, but psychotherapy. And, you know, one of the things that I've seen happening is that people are really isolating and sort of in this, have become this sort of in this funk of not leaving their homes and getting used to not leaving their homes, which leads to more isolation and feelings of depression, anxiety, you know, so absolutely. I mean, I think it's going to be I think we will continue to see the effects of the pandemic for decades.
Agreed. I think so too. They're calling it this complex grief, this ongoing persistent grief that is going to continue for a while. And then, you know, there's another subject that we didn't touch on, and this will be another podcast for another day, is that not only does the pandemic bring this up, but, you know, people that have suffered trauma also are people that, as a result of the trauma, experience mental health conditions these days. And even others knowing that they have suffered trauma, they still want them to snap out of it, and they still want them to get better and just forget about it and don't think about it. It's in the past. And that simply isn't that way. I mean, we know that years ago, you know, the focus was on the unconscious and your childhood, and everything that was ever going to make a difference in your life was going to be, you know, your ages 1 through 5, you know, Freud's stages. And then things changed, and they've evolved so many times. And now sort of the big conversation is trauma. And there's so many books on it, and everyone's writing about it, and everyone's talking about it. And, you know, again, we didn't get to talk about that today, but that is a big, big issue around that. I've had my own trauma growing up, which I didn't address for a long time, and it still affects me. So again, systemically, that's something that we need to address. And maybe next time we'll talk about how trauma influences current mental health conditions and how easily one can be triggered by those.
For sure. Absolutely.
Well, Karen, thank you for sitting with me today. I'm going to have you on again, and we're going to talk more about our live theater show coming in September of 2022 for This Is My Brave. This is mybrave.org for everybody that's listening. And then we will talk more on different subjects that are pertinent to ending mental health stigma.
Great. So great to be with you, John, today.
Thanks, Karen.
Thank you.
Bye-bye.
Bye.